Hey there, I'm Rory Foster, lead instructor at Common Ground International, and today we're working on some simple tips to a simple framework for you to implement all of the free pharmacy and dosing instruction vocabulary in this most recent giveaway. And so today we're going to look at two different levels of implementation here. First of all, for the beginner, we'll do a very simple, straightforward way to give instructions. And then for intermediate and advanced speakers, we'll look specifically at the usted commands, the imperative form, and using the vocabulary that's a part of this download. So first of all, in pharmacy, we've got a handful of verbs that we usually use with medications. First of all, it's take. We've got tomar. We've got darle. Darle, which is give him or give her. That le refers to someone else. Tomar, darle, usar, aplicar. So usar, use, aplicar, apply, maybe for a cream or something like that. And then one more that's coming to mind, poner. Poner, which is to put. Okay, so these are going to be our primary verbs. You may be thinking of more, but really the format here is going to help you use these verbs with everyday pharmacy vocab. So let's jump right in. For the beginner, we don't need to be fancy at all. There are a few sort of cheater instructions, and they're really effective. And so we could start with something like you have to or you must, and a very common way to express that is with a phrase called IK. It's IK. It doesn't make perfect sense when you try to translate this literally, but IK essentially means one has to, one must, and in the direct one-to-one conversation, it basically means you need to do this. It's slightly indirect, which is a preferred way to communicate in Spanish, actually. So, hay que tomar, for example. What's nice about these is you don't have to change your verb around, no conjugation required. It's just hay que tomar dos pastillas, or something like that. Okay, the next one is a little more direct, tiene que. The reason these work well, this works just like IK, tiene que tomar, tiene que darle, tiene que usar. And the reason these work well is because it's really, you're just memorizing this here, and this is directly you have to. You're just memorizing this, and then you don't have to worry about how you conjugate your verb. You just have to have the right vocabulary for number and form pills or drops, and then your frequency vocabulary. Once a day, as needed, etc. All that vocabulary included in the download. Tiene que, a little less strong would be something like debe. Debe, you should. Necesita is you need to. And puede. Puede is you can. And then finally, if we really want to be soft and we just want to ask someone, please do something, then we've got favor de. Favor de. So we've got, for the beginner, no conjugation required, just a handful of phrases. Hay que, you have to, or one has to. Tiene que, very direct, you have to. Debe, you should. Necesita, you need to. Puede, you can. And favor de, please do something. All of these could be negative as well. So, no hay que, no tiene que, no debe, no necesita, no puede, a little stronger now, you can't do this. And then favor de, our no goes here, if we're going to do it. Favor de no usar el medicamento con alcohol or licor, okay? Great. This is perfect for the beginner. You can get started right away giving pharmacy instructions and dosing instructions without worrying at all about conjugations. Now, for the intermediate level speaker or advanced level speaker, you're going to want to give a command. And the commands aren't necessarily, it's not bossy or rude. It is just the proper way And the best equivalent to when you would say something like, take this 2 times a day, or use this cream when you need it, or whatever. Those quick instructions, they're not rude. Oftentimes it's nice to add a por favor on there, but in general, using the command form is not a rude way to speak with your patients. So how do you form it? Well, as you notice here, all of these are in the usted form, which for all adults is what you want to do regardless of how long they've been your patient. Your professional tone wants to always include the usted form with adults. So we need to find the usted command. So this is for the intermediate advanced folks. The usted command is actually pretty easy to form. And if you're at this level, you know present tense verbs, right? Well, that's our start. We start with the first person, the yo form of present tense verbs. So let's take, for example, tomar. And we go to the yo form of tomar, tomo. And so that's step 1. So you go to the yo of the present tense, step 1. And then step 2 is you drop the o. There's no O anymore. And then step 3 is, and this can be a little confusing, but it's not too hard to grasp. Step 3 is add the opposite ending. And so what you know about verbs in Spanish is we've got AR verbs over here, and then ERs and IRs share a lot over here. And these are, we'll call these opposites. And so the AR verbs typically end in an A, and IR verbs typically have an ending with an E in them. And so we're going to add the opposite. So if it's an AR verb, like tomar, we're going to add the opposite ending, which is an E. So it's tome. And so the opposite ending is AR goes to E, and IR goes to A. Okay, so let's look at another here. Poner. Now, poner, put, is an irregular verb in the present tense, but it doesn't matter because a lot of irregular verbs in the present tense have their irregularity in the yo, and that's actually the base of our usted command. And so what's the yo form of poner? It's pongo. We're going to drop the o, and it's an ER verb now, so we're going to add a. And so the usted command is ponga. Ponga, that's the usted command. All right, that's all there is to it. We've got simple phrases with unconjugated verbs for the beginner, and we've got the usted command, which is go to the o, drop the o, add the opposite ending, for anyone who is comfortable already conjugating verbs and using them. And then again, all you got to do is get the free download for all the pharmacy and dosing vocabulary, and you'll be on your way giving medication instructions. Have a great day.